CSF leak symptoms with normal imaging, vascular and autonomic mechanisms. Patients with CSF leak, like symptoms, orthostatic headache/dizziness, tinnitus, occipital or vagal neuralgia, neck pain, but normal MRI are increasingly reported. Even a borderline suprasellar cistern, e.g. 4.2 mm, can be ambiguous. For context, one series found mean suprasellar cistern size almost equals 3.2 mm in confirmed CSF leaks versus almost equals 4.8 mm in controls.janr.org. Thus 4.2 mm is at the high end of the slit range, but not definitive for intracranial hypotension. New studies now emphasize dynamic and functional factors, especially vascular anatomy and hemodynamics, that can produce SIH-like symptoms despite unremarkable static scans. Tortuous PICA and cranial nerve conflicts. Anatomical variants of the posterior inferior cerebellar artery, PICA, can mimic CSF leak symptoms by compressing upper cervical or lower cranial nerves, even when routine MRI looks normal. Notably, occipital neuralgia, C2 pain, has been attributed to an anomalously low PICA loop indenting the C1, C2 dorsal roots. In a 2008 case, a 48-year-old woman's refractory occipital neuralgia was cured by microvascular decompression of a PICA loop entwined with C1, C2 roots. PubMed, NCBI, and LM, NIH.gov. Similarly, PICA vascular loops are now recognized in lower cranial nerve neuralgias. All cases of the newly described hemilaryngopharyngeal spasm, triggered cough, and throat contractions had ipsilateral PICA compressing the vagus nerve. PMC, NCBI, and LM, NIH.gov. Likewise, a recent case of hemilingual spasm, painful tongue spasms, was linked to PICA impinging on the hypoglossal nerve rootlets. MRI showed a tortuous PICA loop near the nerve, and microvascular decompression relieved the spasms. PubMed, NCBI, and LM, NIH.gov. More broadly, PICA is frequently the culprit in glossopharyngeal and vagal neuralgias. Series report PICA contact in 75–80% of cases. PMC, NCBI, and LM, NIH.gov. Importantly, standard MRI slices may miss these contacts unless carefully sought. High-resolution sequences, e.g. CSS, or intraoperative exploration often reveal subtle vascular loops abutting nerves. Thus, in patients with occipital headache or vagal/radicular pain but normal MRI, a tortuous PICA loop should be considered. Even if the vessel does not appear to directly touch the nerve on static imaging, dynamic factors, e.g. head position or pulsations, may intermittently compress it. In summary, recent reports highlight that PICA tortuosity can cause neurovascular conflict syndromes, occipital neuralgia, glossopharyngeal/vagal neuralgia, hypoglossal irritability, without obvious imaging findings. Found. Inc. NIH.gov. PMC, NCBI, and LM, NIH.gov. Spinal CSF-Venous fistulas and hidden leaks. A major paradigm shift is the recognition of CSF-Venous fistulas, CVFs, tiny tears or ruptured arachnoid granulations that drain CSF directly into spinal veins as a cause of spontaneous intracranial hypotension. PMC, NCBI, and LM, NIH.gov. CVFs do not produce an extradural collection, so routine MRI of brain/spine can appear normal aside from subtle signs. In fact, CVFs account for greater than or equal to 25% of SIH cases referred to specialty centers. PMC, NCBI, and LM, NIH.gov. Diagnosis requires dynamic imaging. Digital subtraction myelography or multiphase CT myelography, often with the patient in a decubitus position, is needed to visualize the fleeting egress of contrast into paraspinal veins. In one multicenter series of 48 patients, decubitus CT myelography found the CVF best on the early injection phase in 52% of cases, on delayed images in 12%, and on both in 31%. A small subset were only seen on one passage.janr.org. This underscores that a normal static study does not exclude a leak. Clinically, such patients have classic SIH symptoms, orthostatic headache, neck pain, tinnitus, etc., but lack of visible leak. Sealing the fistula by epidural patch or surgical ligation is often curative. Awareness of CVFs means that when MRI is unrevealing but suspicion is high, one should consider targeted myelography for hidden CSF, venous shunts. PMC, NCBI, and LM, NIH, Gov. PMC, NCBI, and LM, NIH, Gov. A. Venous plexus engorgement in intracranial hypotension. Loss of CSF volume causes compensatory venous dilation. Monroe, Kelly. MRI features of SIH classically include engorged dural venous sinuses, diffuse pachymeningeal enhancement, and venous distension. JNR, org. PMC, NCBI, and LM, NIH, Gov. Recent reports document that the cervical-venous plexus can become markedly engorged during symptomatic episodes. For example, one case of postural headache after lumbar puncture showed a 76 mm enhancing ventral epidural mass in the high cervical spine, which was ultimately recognized as engorged epidural veins. PMC, NCBI, and LM, NIH, Gov. PMC, NCBI, and LM, NIH, Gov. PMC, NCBI, and LM, NIH, Gov. With conservative treatment, the enhancement resolved, confirming venous dilatation rather than abscess. PMC, NCBI, and LM, NIH, Gov. Such cases show that SIH can present with neck pain or radiculopathy from cervical venous engorgement. Clinicians should recognize a smooth enhancing epidural band on MRI, often sparing midline, as engorged epidural veins. PMC, NCBI, and LM, NIH, Gov. PMC, NCBI, and LM, NIH, Gov. PMC, NCBI, and LM, NIH, Gov. Figure. MRI of the cervical spine in intracranial hypotension. The ventral epidural enhancing process, ARROS, was initially thought to be a mass, but follow-up showed it to be engorged anterior epidural venous plexus. Such venous congestion may occur in SIH and mimic pathology. PMC, NCBI, and LM, NIH, Gov. Quantitative imaging confirms this. A 2024 case series used extended cervical CT scans and found that in all SIH patients, the upper cervical epidural venous plexus was grossly thickened, mean 4.8 mm, and then decreased after treatment, 3.6 mm, PMC, and NIH, Gov. The authors conclude that looking for upper cervical venous engorgement on CT can aid SIH diagnosis. PMC, NCBI, and LM, NIH, Gov. More broadly, upright/postural imaging studies highlight dramatic venous shifts. One CT angiography study showed that when standing, the internal jugular veins collapse while collateral emissary veins, anterior condylar, internal vertebral plexus, marginal sinus, etc., dilate substantially. Nature.com. Nature.com. For instance, cross-section of the anterior condylar vein increased 144% when upright. Nature.com. In practice, this means neck venous pressure and volume can spike in upright or extended postures. Thus, positional changes can exacerbate venous congestion in susceptible individuals. Not coincidentally, patients often report worse tinnitus or headache when upright, reflecting both low CSF pressure and increased vertebral venous pooling. Autonomic effects, POTS, and arrhythmias. Cerebrospinal fluid loss can trigger autonomic disturbances. Recent cases link SIH to secondary dysautonomia. One report detailed a patient with orthostatic headache and postural tachycardia, POTS, whose symptoms, headache and tachycardia, promptly resolved after epidural blood patches PMC, NCBI, and LM, NIH-Gov. This suggests that CSF hypovolemia can provoke POTS-like reflexes, and clinicians should consider cult CSF leak in unexplained tachycardic. Orthostatic intolerance PMC, NCBI, and LM, NIH-Gov. Conversely, neck trauma or malalignment may induce POTS/dysautonomia. For example, a case of chronic orthostatic tachycardia and dizziness was linked to cervical spine misalignment and improved with chiropractic correction of the neck PMC, NCBI, and LM, NIH-Gov. More dramatic are reports of cardiac arrhythmias triggered by neck movement or pain. In neurosurgery, repositioning the head has been observed to alter rhythm. One patient with new atrial fibrillation before craniotomy spontaneously converted to sinus rhythm when the head was extended and elevated, likely by changing intracranial pressure/hemodynamics. By NIH-Gov. By NIH-Gov. PMC, NCBI, and LM, NIH-Gov. Similarly, severocraniofacial or upper neck bradyarrhythmic syncope PMC, NCBI, and LM, NIH-Gov. This pain syncope underscores that irritation of cranial nerve 9/X in the neck can evoke cardiovascular collapse. In some, neck movement or posture can elicit arrhythmias, tachycardia or bradycardia, in susceptible patients, whether via CSF pressure shifts or via aberrant nerve reflexes PMC, NCBI, and LM, NIH-Gov. PMC, NCBI, and LM, NIH-Gov. PMC, NCBI, and LM, NIH-Gov. Clinical implications and diagnostics. These emerging insights suggest multiple hidden mechanisms for CSF leak symptoms when MRI appears normal. Key takeaways for clinicians and radiologists include: dynamic vascular assessment. Consider upright or dynamic CT/MR angiography to reveal venous engorgement not seen supine nature. Calm nature. Upper cervical CT, beyond skull base, can show epidural plexus engorgement. Inquired NIH-Gov. Specialized myelography. If SIH is strongly suspected but spine MRI is negative, pursue decubitus CT myelogram or digital subtraction myelogram to detect CSF, venous fistular, or neurovascular decompression. In neuralgia cases, occipital, glossopharyngeal, vagal type. Examine for tortuous PICA or VA loops contacting nerves, even if subtle. Microvascular decompression has cured occipital and lower cranial neuralgias in sick patients. Inquired NIH-Gov. Pub. Inquired NIH-Gov. Inquired NIH-Gov. Autonomic evaluation. Recognize that orthostatic tachycardia or unexplained arrhythmias may relate to CSF volume status. Testing for POTS or cardiac reflexes may be warranted, and treating an underlying leak can normalize autonomic function. PMC, NCBI, and LM, NIH-Gov. PMC, NCBI, and LM, NIH-Gov. PMC, NCBI, and LM, NIH-Gov. Holistic approach. Finally, integrate cervical spine assessment, e.g. instability, alignment issues, since compression of cervical nerves or vessels can mimic CSF leak syndromes, a modern reappraisal of Barr, Lur, and related syndromes. In summary, recent case reports and studies emphasize that normal conventional MRI does not rule out pathophysiology in these patients. Vascular dynamics, both arterial loops, e.g. PICA, and venous plexuses, play a critical role, as do subtle CSF, venous leaks. New imaging techniques and a broad differential can uncover treatable causes of these perplexing CMP-TONS. PMC, NCBI, and LM, NIH-Gov. 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 Sources: recent case reports and reviews, 2020 to 2025, of SIH, CSF, venous fistulas, neurovascular compression syndromes, and related autonomic phenomena. PubMed, NCBI, and